歡迎大家出席今。
Welcome to the press briefing. With us, we have Dr. Zhang Chokwan, Head of Communicable Disease Branch of Center for Health Protection, and Dr. Gladys Guan, Chief Manager from the Hospital Authority. Dr. Zhang, can you give us an update of the cases, please? Last night, we had 176 positive cases by PCR, 28 picked up by HA32 by Center for Health Protection, Public Health Laboratory, and 116 cases from private labs. 270 cases positive by RAT. So we have a total of 446. In the fifth wave, we have 1.2 million 2007 cases, 750,253 positive by PCR, and 451,754 by RAT. Well, on June 1st, we verify the positive cases through RAT, and then about 20% of them, of the 72 cases, were negative. For imported cases reported today, we have 64, including 53 tested positive by PCR and 3 by RAT. Among them, 32 cases were picked up on arrival, 15 on the 3rd of June from 9 flights arriving in Hong Kong, and 15 on the 2nd of June from 10 flights. 24 cases were picked up in quarantine hotels. We have another 10 picked up on day 10 in the community. 8 of them tested positive by PCR, 2 through RAT. Among cases picked up by PCR, most of the cases had a very high CT value. They could be repositive cases. 1 or 2 cases of them had a lower CT value, and for cases positive by RAT, the CT value would usually be lower. These cases could be local cases. So cases tested positive through RAT will double check by PCR and do some genome analysis. For care homes, we have got 1 cleansing worker from RCH for the disabled. That RCHD had the last case on the 23rd of March. That cleansing worker had contact with 3 residents, so they were classified as close contacts and sent to quarantine. The cleansing worker could have got the disease from the community. For schools, although today is a public holiday, some cases were reported to us by schools. First, a Christian Alliance school, 5 cases of 5 students reported, 4 from class 2A, where there are 24 students in total. Well, they had a fever in the last couple of days, and they sat rather close together in the classroom. So we advised the class to suspend class until the 10th of June. During recess, they sometimes ate and drank, but there were partitions. There was another case from the same school in another class, may not be linked to this class, but we will keep in view the situation. The last day of school was the 2nd of June for this school. And then we have got a smaller Hong Kong Protection of Children's Society Santa Claus childcare home. We're talking about infants, 3 in N1 class. 2 coming from the same family. They are siblings. Another one in the same class. There are only 40 kids in a class. They do not have fixed seating. Well, they take naps in school. They are about 5 years old. So we have suggested this N1 class suspend class until the 10th of June. There was a jazz dance class in Precious Holy Trinity College. 3 more cases were reported also from the jazz dance class or jazz class. There are 6 students in this class positive. 2 students not from that jazz class, but then because there are students from different classes to joining the dance class, so there was 1 confirmed case from class 1C and 5C respectively. They tested positive through RAT. So the last day of school for them was the 2nd of June to play safe. Now for students of the dance class, they are required to be home quarantine, and we advise that classes 5C and 1C suspend classes. And then we have Wong Kam Fai Primary and Secondary School of Hong Kong Baptist University. 1 student and 2 teachers are in a French class. There are 5 students in the class. So 1 teacher and 2 students are positive cases. The last day of class was the 31st of May. These students come from different classes of the school. However, classes, we do not have any case from classes not in the French class. We do not have any new reported death case. So the tally is still 9,168, 3,785 female and 5,384 male. For local BA.2.12.1, we have 1 more case that is unlinked. It is a 70-year-old female who lives in a mountain terrace Yishan mansion of Taikoo Shing. There was no previous suspected case of BA.2.12.1 from Taikoo Shing. So on the 28th of May, she felt unwell. She did an RAT and tested positive on the 31st of May. We cannot find any linked case here. She's been to a noodle 八方池上 in City Plaza and also popcorn. She went to Qishan Bintong on the 27th of May at around 2 p.m. and also at around 2 p.m. on the 30th of May. She went to Jade Garden of Popcorn, Jiangguan-o, for dinner on the 29th of May. And also on the 28th of May, she went to lunch at around 2:30 at Chong's Kitchen, and also a cafe, the Coral at Jade and also Pearl Plaza, and also to a Chinese restaurant, Hai Gong Wei in Cornhill on the 28th at about 10:30. So we have not seen any transmissions in these places, but they will be put under our compulsory testing notices. Now, for Central, we have 2 more cases that make up 35, 18 female and 17 female, aged 17 and 30 years old, and 3 more cases for Iron Ferries. So 51 visitors and staff members are now positive. 31 female and 22 male, aged between 18 and 58, and the earliest day of onset was the 28th of May. And in the Link cluster, we have 44 cases more. There are 65 cases in total, aged between 18 and 41. They started to feel unwell on the 29th of May, 40 male and 25 female. 6 were at Link for 2 evenings. About 55 of them in total went to Link on the 28th. As for Shuffle, I think I've missed out some points.
At Shuffle, 27 additional cases are reported. 42 in total are involved. 28 females, 14 males. That's all from me for today. We will now hear from Dr. Gladys Kwan, who will tell us about the HA situation. 351 patients are staying in hospitals. 28 are new COVID patients. For those who required isolation, 72 are staying at isolation ward. 12 are staying at Tier 2 isolation ward. 29 are staying at the North Atlanta Hospital Hong Kong Infection Control Center. 13 are new COVID patients. Yesterday, there was no report of new critical patients, but one patient was in a serious condition. For those staying at isolation intensive care units, there are 6 such patients. 12 patients are in a critical condition, 7 in a serious condition. Over the previous day, no COVID patient passed away. Over the previous day, 36 patients recovered, 25 were discharged. In the 5th wave of outbreak to date, 50,458 patients recovered. 50,105 patients have been discharged since the beginning of this year. 62,838 patients have recovered. 62,485 patients were discharged. Yesterday, a patient was found COVID positive through admission screening and testing. 2 patients in the same ward are classified as close contact. For HA staff members, 23,499 workers were infected. 23,409 workers have returned to work. That's all from me for today. The floor is now open to questions. Please put up your hand. Our staff will pass you the microphone. Before putting your questions, please tell us your media outlet. The lady at the back. I'm from Hong Kong 01. In your tracing efforts for the bars, what's the source of the transmission for Iron Ferries and Central? And for the 2 bars that have seen recent infections, have you managed to get hold of all the customers? If not, how many people do you have to reach? What's the difficulty in preventing you from getting hold of these people? Now, people declare their RT positive results online. Do you make no distinction between the kind of Omicron subvariant? And given that's the case, what's the impact that would have on your tracing efforts? What more will be done, as there may be new subvariants out there for the schools? For the Holy Trinity College, Class 1C and Class 5C, how many students are there in each class? Now, there are figures announced these 2 days regarding the verification of previous RT cases declared. What's the effectiveness? So roughly 20% of RT positive cases are found to be negative after verification. Is it because they want to be exempted from the vaccine pass requirements? Can we just stop there and let the doctors address the questions first? For Central and Iron Ferries, the source of the outbreak comes from the community. For the two new bars, Link and Shuffle, we uncovered the infections there, and we just got started with the compulsory testing. We're still waiting for the information through the vaccine pass. When we first found out these infections, the symptomatic carriers reported their infections. And after the compulsory testing arrangement, more cases are uncovered. For all RT positive cases reported online, they will be verified through the PCR tests. And then we will be able to tell the kind of subvariant. And then we can tell whether it's the BA.2.12.1 subvariant. And if needed, there will be a whole genome sequencing to come. For classes 1C and 5C, I don't have the specific figures. I think it's 20 or so students per class. For rapid antigen tests, there are some false positive cases. Now, sometimes there may be more false positive cases. The rate may be 1 to 3%. Back then, there was a time when the false positive rate was around 7%. Now, the rate we see far exceeds the levels seen back then. So we have reason to suspect that some positive cases declared may not be positive cases indeed. Some may be dated test results from some time in the past. Next, the lady in the yellow jacket. I'm from ... News. 2 days ago, Dr. Chuang said that vaccination would not lower the risk of infection. But for restaurants and bars, there are now clusters. Some students got infected during their afternoon nap. Would there be measures to minimize transmission risks? Or is the focus now just on preventing severe cases and deaths? The second question, the mutant strains are spreading more quickly. Some experts argue that there may be secondary or tertiary transmission for these mutant strains. Would there be stepped-up efforts in tracing the cases? Some experts say that there will continue to be a low level of transmission. And they're saying that means that we're going towards endemicity with COVID. So does that mean that we'll keep facing COVID cases down the road? Vaccination will help lower the transmission rate, but this will not be 100% effective. It depends on the number of doses, and it also depends on the time that has left since the jabs. But vaccines remain highly effective in protecting against severe cases and deaths, which the figure being more than 90%. In terms of minimizing or reducing transmission, vaccination provides limited protection over a limited period, but for protecting against severe cases and deaths, vaccination remains highly effective. For secondary or tertiary transmission, Omicron spreads quickly, and it also comes with a short incubation period. And within a day or two, people start feeling unwell and symptom onset happens. People get tested and then declare the results, but then the transmission has already happened. But this is different from what we saw before the fifth wave hit. In many cases, the family members and friends of infected patients have already been affected, so the spread slowed down. And there are so many silent transmission in the community, it would be hard to conduct a tracing.
Next, the lady over there. I'm from cable TV. Regarding the Christian Alliance School, Sun K Primary School, Christian and Missionary Alliance, Sun K Primary School. Now, in the classroom, there are partitions, and students ate and drank in the classroom. And still, we have seen cases. Does that mean that eating and drinking should be banned inside classroom? And for the offending nursery school, how did the kids got infected? Was it because of their taking naps? And how can we stop the transmission there? And for Wong Kam Fai Secondary and Primary School, there are cases in the French class. How did that happen? And what about the student who had a BA.2.12.1 in nursery in Wan Chai? Have you found a similar viruses in the kids' family members? Now, because the virus is highly transmissible, is a number of cases in KGs and CCCs are much more than expected. Is there intention for a class suspension in KGs and nurseries? Now, in schools, even when all students were wearing masks and taking the exam, there was some transmission because Omicron is highly infectious, and the sublineage PA.2.12.1 may even be more transmissible. So in schools, whether students are wearing masks or not, infection is still possible. Of course, when mask off, the infection may even be more serious. And in kindergartens and in French classes or the like, all students and teachers are required to do RAT on a daily basis. These minor transmissions are picked up through daily RATs, so hopefully there won't be major outbreaks in schools. As for the suspected case of BA.2.12.1, the full genome analysis is still ongoing, and we do not have details to add here. Next, the lady in the very last row. Good afternoon, I'm from Now TV. Now, for Sun Gay Primary School, are you talking about Holy Trinity School or the one in Shakib May? And where do these kids live? Are there cases in the buildings where they live? And is a Christian and Missionary Alliance, Sun K Primary School in Chang Kwan O. What about the other one? Speakers off mic. Well, I don't have a breakdown for that because we have over 500 cases. I have not got a breakdown of the individual addresses. Ming Pao. I'd like to ask about the figures for the bar clusters. Now, if we look at the figures for Iron Ferries and Link, I think they don't tally with what Dr. Zhang said yesterday. And for Wong Kam Fai Secondary and Primary School, we talk about the primary or the secondary section. And for Hong Kong Christian Service Times Nursery School, the student that is suspected to be carrying BA.2.12.1, I'd like to know the district they live in and also where do family members work. Perhaps I mixed up some of them. Central has got 35 cases in total. Iron Ferries, 53 cases, 2 workers and 51 patrons. I don't have the addresses and places of work for these cases and their family members. As for the suspected case of BA.2.1, restaurants and also the building they live in are now under the compulsory quarantine notice. No more questions? All right, one last. I'm from TVB. Good afternoon. So for Central, Ancaris, and Link, Central, Shuffle, and Link have got patrons who patronize the Iron Ferries as well. Now there are 2 workers from Iron Ferries positive. Could it be possible that they have spread the disease to some other patrons? I think we have to check the results of genome analysis first. Even if they've been there, doesn't mean that they have got transmission chain. And then the genome analysis result of Central and Iron Ferries were different. The PB ends here. Thank you very much. Speakers off mic. Speaker is off mic. You're talking about Shuffle, right? Fourteen cases from Shuffle yesterday, and today the total is 42. Speaker is off mic. Now, schools are not required to report to us today, and it's just that some schools have chosen to report to us today. After the holidays, I think we will have a fuller picture.